Okay, this video is the quotes of a lady by the name of Lorraine Daay. She had breast cancer. She survived breast cancer for about 30, at least 33 years, something like that. So she's pretty extraordinary. This lady is a genius. She was chief of orthopedic surgery at San Francisco General Hospital. One of the things you're going to see about female geniuses, they're like some of the most hated people in the world. Okay, so she was constantly in trouble and a lot of people hate her, but man, was she smart. Wait till you see what she did. So basically, she figured out how to survive metastatic breast cancer for 33 years about. She recently died. A couple things about her. She said that her father taught her to think for herself. He used to say, do not follow the herd. And so she developed the ability to think independently. And this lady is a real genius. She figured out that drugs don't work, which most doctors never figure that out. But it's pretty obvious when you think about it. She said she believed the lie of conventional medicine that the only way to treat disease was drugs and surgery. But the HIV crisis, she said, changed her mind. She said that because she was a trauma surgeon, chief of trauma surgery, she had to work on a lot of messy patients with blood all over the place, and they have to drill through bones to fix fractures in patients with motor vehicle accidents and all that. And she was worried about the risk of doctors getting HIV. And a lot of doctors were. I can remember some of my medical training was back in those days, and everybody was real afraid, and nobody understood HIV initially. And infectious disease doctors who don't get any blood on themselves were telling her that drug addicts get HIV from needle sticks, but doctors don't. And she's like, that's nonsense, because the orthopedic surgeons were afraid they were going to stick themselves. Okay, plastic surgeons were afraid too, because they're working with very small needles. It's a scary business. Okay, so when she started talking about doctors needed better safety and they should be able to test the patients for HIV and things like that, she got tremendous backlash from San Francisco Hospital, and they were very nasty to her. And they said that if a patient ever sued her because she sent their labs for testing, that they would not defend her, they would fire her, they threatened to fire her. She's like, I'm just asking to do what we do with every other disease. Why is this disease treated differently? Okay? And so that left a bad feeling with her about how conventional medicine handled things. She says that pharmacology is sorcery. She says God heals you, but the medical system does not want you to get well, or it doesn't know how to help you get well. She says anything that makes your hair fall out and makes you vomit is not healing you. She says you need your immune system to remove cancer from your body, but chemo wipes out your immune system, so how can that make you healthy? She said most patients get chemo and it shrinks their tumor, but then the cancer comes back and kills the patient. She recommends against chemotherapy and radiation therapy. She says radiation therapy for breast cancer or lung cancer causes increased risk of death from heart disease. That would, of course, depend on where it was located. She claims that immunosuppressive drugs for transplant patients are very much almost the same as chemotherapy for cancer, and they're a bad idea, and that they increase the risk of cancer. She says the idea of giving immunosuppressant drugs for arthritis, she says, is insane. She thinks it's crazy. She said the treatment of glaucoma should be like the treatment of hypertension, and glaucoma drugs are dangerous. She says that hydration is a very important way to decrease blood viscosity and blood pressure. So she recommends adequate hydration. Well, that's a little bit overrated. You can treat hypertension with diuretics. She says one of the best ways to decrease your blood pressure is to stay well hydrated. That's what she claims. She says it's good to have an attitude of gratitude. She then says, what causes hypertension? Okay, she says dehydration, but hold on a sec. We know high-fat diet and excess sodium are major causes of hypertension. She claims that for all the chronic diseases, the same health plan works for all these diseases. She says every disease is helped if you improve blood flow and hydration and decrease stress. She didn't say blood flow, but she said hydration and you decrease stress. She says God's plan for healing is free. It's available to everyone. It's been available since the beginning of time. It has no side effects. It's available everywhere to everyone. It is eat the vegan diet, pray to God, get sunshine for vitamin D, get adequate amount of sleep. She says if you're really sick, like you're newly diagnosed with cancer, she says it's much, much better to retire from the job so you'll have more time to focus on your healing. She said, to get well, you must admit that your disease is your own fault, that you caused it by, sort of what you were eating and how you were living. She says, if possible, try to grow your own food. Try to avoid toxins like F- in your water, MSG in processed food. You must let go of your anger in order to get well, because that'll reduce your stress level. You should have an attitude of gratitude. You need to get your sleep. You need to stay hydrated. You need the vegan diet, and you need to pray. She was actually doing a PhD in molecular and cell biology. She was working as a dental hygienist to help pay her way through college and med school. And then again, she was an orthopedic trauma surgeon in San Francisco General Hospital. She'd been an ovo-lacto vegetarian for many years, but ovo-lacto means eating eggs and milk as well as plant foods, but that was not good enough. She was also eating meat substitutes at the time, stressed out, drinking 6 cups of coffee. This is when she was diagnosed with breast cancer. And she says that caffeine, aspartame, MSG, they're all bad for the brain. She did have 2 children. Her cancer was diagnosed about 1992. The breast nodule was initially removed by a friend, and it was done with local anesthetic. She wanted to see it when it was removed. That's the way really smart people are. They want as little anesthesia as possible. But she had positive margins. Then she had a lumpectomy, and again, she had positive margins. She refused chemotherapy and radiation therapy. She says that having a you-know-what increases the risk of breast cancer. She says that when she talks to patients, she's real dramatic and over the top. And she says the reason she does that, she says, I want the patient scared. She says you have to scare the patient, otherwise they're not going to be willing to change. I would actually say there's a lot of truth in that, because I talk to lots of patients. My friends, we talk to lots of patients. Most patients, they don't really care. They think everything's a big joke. And part of it's because they don't understand. Patients think drugs are real and all this nutrition, lifestyle stuff's a bunch of BS. But actually, the nutrition and lifestyle stuff is more important than the drugs, but the patients don't understand that. In addition, most patients, they don't understand they're sick. They don't feel that much symptoms from having abnormal lab values, and they don't really take it that seriously. Because it's kind of funny, like a patient will ask me, oh, should I get a cardiac calcium chest CT? And I'm like, why would you want to do that? You already have coronary artery disease. Why would you want to radiate your chest? You know you have it, do the diet. What do you need another test for? It's like, I'm triple boarded physician with 30 years of experience in cancer screening studies. And I can tell you, I don't ever want to get x-ray on myself. I hope I don't ever get an x-ray or a CAT scan the rest of my life. I just want to keep myself healthy, so I don't need that stuff. I don't want to volunteer to get radiated. For what reason? Don't get me wrong, the dosages are small for one examination, but the point is, why not do the thing that gets you better? Eat the diet, live the way you should, rather than run around getting tests all the time, especially for something when you already know you have it. Okay, she goes on. She says a person should drink 10 glasses of water a day. Now that sounds crazy to me. That sounds like too much to me. The other thing I would say too is if you're going to drink all that water, make sure you know what you're drinking. Okay, if you're drinking reverse osmosis water, it's too hypoosmolar. If you're drinking tap water, it's full of toxins. So, you can squeeze a lemon into it or something like that. She says you need your immune system to remove cancer cells from your body. Chemo wipes out your immune system. That's not good. She says it comes out of the drugs, the chemicals made in World War I and World War II, and they're bad, and she doesn't like that idea. Okay, she talks about how caffeine is bad. It's a diuretic, dehydrates you, and it also causes insomnia. She also says one of the most important things you could know is that most of the so-called famous experts in healthcare are not good, and you should not trust them, because once you realize that you can't trust them, then you will be motivated to go learn on your own, to read and try to find useful information. Okay. This is sort of before the internet became popular that she gave this talk. She says that F- in tap water is rat poison. It doesn't really significantly help teeth. She says dentists are clueless. She says the reason there's a warning on toothpaste to call the poison control center if you swallow any is because F- is a poison. She says getting sunshine helps to slow cancer growth. She says God is our Father. She says real Christian music is based on melody. Rock and roll often has a satanic beat which increases vulnerability to drugs and promiscuity. TV is not neutral. It is controlled by the very, very rich. She says the internet is largely controlled by the very, very, very rich, but at least it is possible on the internet to potentially find the truth about stuff. She says TV does subliminal stuff like promote you-know-what. She says that people spend excess amount of time in artificial environments. She says it's much better to breathe air outside of doors, and this slows cancer growth by about 50% compared with indoor air. It's harder to get well if you are working full time, so you should quit your job at least for a while and take time off so you figure out how to get well. You should never watch TV or read newspapers because it's all propaganda and lies. Okay? She says to get well, you need time with God and to pray to God for improving your health. Okay? She says humans are meant to live in agrarian societies, not in cities. I actually think that's true. We do well in agrarian societies. Okay? We can help each other. We know our neighbors and our friends, and we grow food. We can loan food to each other. Thomas Jefferson said the same thing. USA should be a nation of family farms. And it used to be more like that, and it was a much, 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 much better country. It was Thomas Jefferson was sort of battling out with the Federalists, like Alexander Hamilton was pushing for, the city routine and more of a England style of rule. Thomas Jefferson wanted more freedom. Anyways, he was on the right track. He wrote the Declaration of Independence. Okay, she says that a major cause of death is anger because it increases stress, which immunosuppresses us. She says laughter does the opposite. It decreases stress and improves immune function. She says it's better to have cancer than a myocardial infarction, a heart attack, because MI can cause a sudden death. She says with cancer, you've got some time to learn and figure out how to get better. You need to learn how to manage your stress because it decreases immune function. She says Christian music is good for you, classical music is good for you, because they both increase your IQ, make you smarter, but beat music is bad. It lowers your IQ and makes you stupid. You can't think when there's a bump, 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 bump beat. You can't think with heavy metal grunge. Rah, rah, rah. You can think and be calm and peaceful and happy when there's a nice melody. She says you can't get well until you admit the disease was caused by yourself, your diet and habits. After diagnosed with cancer, she became 100% vegan, and she says, I don't eat anything with a label on it. She says raw food is the best. That's an interesting statement that she thinks raw food is best for cancer. Ruth Hydrant started out on the McDougall diet and gradually moved to eating a raw diet and felt that was largely convenient. I don't know if it was better for cancer, but it was real convenient for her. That lady, Janet Murray, the one who wrote the book about raw, can cure cancer, she recommended a raw vegan diet. And Lorraine says, God made our food raw. Did Adam and Eve have a store? Genesis 1:29, we're supposed to eat plant foods. She says it takes more than a vegan diet to get well from cancer, though. You have to minimize your stress. You should stay hydrated. You need to maintain social support, get your sleep, pray to God, all this stuff. She says disease is partly spiritual. God never treats cancer with chemo. She said God can do anything as he strengthens you. She's very religious. A person needs the will to get well. She says watching TV weakens you. She says you think better when you're well hydrated. You need to know there's no truth out there except what comes from Jesus. If somebody tries to control your food, they're trying to control you. She says the Bible has a better health diet. The only way to get well is to follow God's way. You need to know there's no truth out there except God before you will accept God's way and get well. She says most people are stupid. They choose man's way and they try to get well with pills and they never get well and they have bad outcomes. She says a person who's smart will study what is the normal way for humans to live and be healthy. And that's God's way, eating the vegan diet and doing all these things she talks about to reduce stress. She says if we live healthy and eat her whole food vegan diet, we should die of old age and not of disease. She says people need to know the experts are mostly fake. Okay, we already went through that. There are no incurable diseases. Psalm 103. She all talks about this. I'm kind of repeating myself. She herself almost died when she had her metastatic breast cancer. Then she tried all the alternative medicine ways of healing, and they didn't work for her. She says doctors don't know anything about how to cure chronic diseases. In college, they have to behave themselves and not rock the boat. In med school and residency to get a job, they are expected to not rock the boat. And then they're locked into tons of debt, and so while they're attending, they almost never rock the boat. And she says these diseases do not just fall from the sky, nor do they just happen. They're the result of years of bad habits, okay? But the good news is we can reverse these diseases by changing the way we live, think, act, and handle stress. There are no incurable diseases. A person should have one bowel movement, ideally after each meal. It's called a gastric colic or reflex. She says cancer doctors, in her opinion, don't really know what they're doing because they die of cancer at the same rate as the general population. She She says if they knew what they were doing, they would have better outcomes. She said, why are doctors not taught how to get people well from diseases? Because the drug companies have enormous control over medical schools and the training doctors receive. And they also control the medical journals, which establish the standard of care for practice. She says if a medical journal started publishing articles that contain information about how to get a patient well without prescribing drugs, the drug companies would pull all their advertisements and that journal would go bankrupt. So it's not hard to figure out why medical journals refuse to publish articles on natural healing. Yeah, I ran into problems. I couldn't publish my papers on spine and some other stuff on the brain because they wouldn't publish them because, I talked about healing stuff with diet. They don't want to hear that. Why has conventional medicine failed so miserably? Because decade after decade, they look in the wrong places. They continue to develop more drugs, all of which are harmful and never cure disease. They continue doing genetic research as though cancer and diseases could be cured by manipulating one's DNA. But they absolutely refuse to study or to teach lifestyle factors. That's true. One reason they refuse to look at diet and lifestyle factors is that would make their high-rise glass and metal buildings, their thousands of medical researchers, the billions of dollars of research funding, and all their false erudition completely irrelevant. Yeah, it would show that it's just a big joke. All diseases are caused by the same factors, and all diseases can be reversed by changing those factors. Okay? The only way to cure a disease is to find out the factors that cause it and then to change those factors. And no one can do that for you. You must do it for yourself. Yeah, I can teach you with these videos about what causes disease, but you got to decide for yourself that you're going to commit to eating healthy and living healthy. To prevent attention deficit disorder, change the Dow's diet to all natural whole foods, fruit, grains, and vegetables. Eliminate dairy and other animal products because these contain hormones, pesticides, and antibiotics, and the diseases of the animal itself. Eliminate caffeine, sugar, and other sweets, processed food, food dyes, MSG, MFG, aspartame, and other sugar substitutes, and any foods that contain preservatives, food dyes, or other chemicals. Eliminate eating at fast food restaurants and, as most use MSG, etc. Eliminate soda pop. No white bread, no peanut butter. Go to bed early, get proper exercise daily, get sunshine, go outdoors. No TV. Teach your child to trust in God. Study the Bible and pray with your child every day. Read Bible stories to your child. If they learn about Jesus, they will admire him and want to be like him. This has the most calming influence of all. Okay, let's see. Nothing has changed in modern medicine. Those who do not conform to the corporate endorsed medical norms of orthodox medicine, even if their modalities of treatment can be proven far superior to the establishment methods, they will be rejected and ridiculed, and if they continue, their license to practice is often revoked. The basic message to non-conventional practitioners of healthcare is that you must do it our way or we will destroy you. No orthodox physician knows anything about getting people well from any chronic disease. When one studies the theory of evolution versus creation, it is clear that there is overwhelming evidence for creation and there is no evidence for evolution. She actually has a good point there. I was an A+ student in evolutionary biology at Stanford University, and I can tell you, the origin of life is not a question of biology, it's a question of geologic chemistry, and geologic chemistry cannot answer that question. Nobody knows what really happened, but God makes a lot more sense than a lightning bolt landed in a bucket of pond water. Okay, the more you look at it, intelligent design makes sense. I mean, we got 3.3 billion base pairs in the human genome. Where did all that information come from to write 3.3 billion base pairs? The amount of information, it's staggering. The design of the little nanomachines inside our cells, like ATP synthase on the intermitochondrial membrane, it's like millions of times beyond anything humans could do. You think that happened by chance? Okay, Darwin's evolutionary theory is not true. People believe in Darwin's theory because they do not want to be accountable for God. Well, rulers don't want anything accountable to God. They want themselves to be the equivalent, like the Roman emperors. Okay, she said, doctors have a shorter life expectancy than the general population, and they have a higher suicide rate. So why would you go to them for advice about your health? They don't even know how to make themselves healthy. How can they possibly help you? It is impossible to cure disease unless you know what causes it, and then you avoid the cause. Okay, anger causes decreased immune system function. Stress increases cortisol, which decreases immune function. Increased blood pressure increases atherosclerosis. We know all that. Insomnia decreases immune function, and it leads to impulsive behavior. If I had known then, when I was first diagnosed with breast cancer, what I know now, I would not have had any of the tumor removed. Lorraine, that's what she says. Okay. The 100% vegan diet is very important, but you need to do more than that. You need to put your trust in God. Trust God, study the Bible, pray. God gives you a 100% guarantee. Okay, we talked about optimizing sleep, sunshine, avoiding toxins. Okay. Then she says you cannot cut cancer out. Cancer is a systemic disease. It is circulating in your blood. I found out that a lot of people have gotten better with a 100% vegan diet. You must learn to trust God instead of man. Only God can make a tree or a human. Doctors cannot make a tree or a human. This is another reason why you should trust God instead of man. Okay, almost done here. People who get well from cancer are always on a vegan diet. Okay. And she quotes some Bible quotes, like here's Deuteronomy. It says, if you follow my laws, the Lord will take away from thee all sickness and will put none of the evil diseases of Egypt upon thee. Okay. She says, most people want a quick fix for health problems, but there aren't any quick fixes. Okay. She says, each mammogram a woman gets increases her risk of breast cancer by 2%. She says, silicone breast implants decrease immune function. Much fewer than 1% of diseases are genetic. She says the only way to cure cancer, in her opinion, is change diet, exercise, attitude, religion, and decrease stress. Okay. She did like smoothies with carrots and green smoothies. She doesn't like beans for cancer patients. She didn't go into the protein issue, but that's why I would avoid them. Too much protein, even if it's a plant protein, too much protein in beans if you're a cancer patient. And okay, she recommends to eat earlier in the day. Try to get to bed earlier, by 10 p.m. at the latest. If you got cancer, even try to go to bed by 9 p.m. She says the best hours for healing are between about 10 p.m. to 2 a.m. I would think the deep sleep initially. She says Eastern medicine and her Eastern meditation is awful. She thinks Eastern religions are really bad and people should avoid them. She says we were never meant to eat God's creatures. She thinks the Bible, Genesis 1:29, is the diet we should be eating. Okay. She says meat kills a lot more people than smoking tobacco does. But the corporations just deny. Let's say, she says F- makes people docile, and that's why it's put into anesthetics and it's put into municipal tap water. She says Cl- is a poison, and that's why it's also put into tap water. And Al is also put into tap water. Let's see, she talks about caffeine being a diuretic and a nerve toxin. It's a brain toxin, it is. Let's see. She talks about rebound hypoglycemia being a bad thing, aspartame bad. Let's see. She says pharmacology, in her opinion, is evil. It's sorcery. God is love. Love never fails. Okay, let's see here. I know this is going on kind of long, but, let's see. All right, we went through almost all this. Let's see if I got anything else. All right, well, that's all I got. I hope you found that interesting.